And then we also look at the evidence-based information out there. We provide guidance and tools to help schools implement effective policies and practices. These are some of our product line of tools that thousands of schools across the nation. We wish there were tens and tens of thousands more, but many are using it to have an impact and to improve the education and the services that young people receive in schools. We provide funding and technical assistance, and our niche is interesting. We don't necessarily work so closely with health departments, but with education agencies. So we bring HIV prevention into the school systems of the nation, and we help those agencies deliver high-quality, evidence-based sexual health education for all students, to increase youth access to sexual health services, and we really are very active promoting HIV and STD testing in high prevalence communities. We do a lot of work to establish supportive school environments to get at those root causes. It's not just family rejection, it's the harassment and bullying and discrimination that young people experience at schools that drive them to engage in high-risk behaviors. So we do a lot of work to help schools establish positive, supportive environments for the young people who are at greatest risk. And we work with schools to help enhance youth resilience by promoting protectiveness factors. These things include things like school connectedness, so young people feel that there are adults in the school community that care about them. That is a profoundly powerful HIV prevention intervention, as well as teaching parents how to talk with their children about sex, and to monitor their children's behavior so that they themselves can be the primary agents for HIV prevention. We devote a lot of attention to meeting the HIV/STD prevention needs of the groups of highest risk, namely LGBT youth and young men who have sex with men. Some of the things that we do include collecting the data, of which you've seen some examples, and the funding and technical assistance we provide to education agencies in states and cities. That's used to provide professional development for teachers and other school guidance counselors and nurses and other school staff so that they can meet the needs of these young people. It's used to implement policies that prohibit harassment based on a student's perceived or actual sexual orientation or gender identity. It's used to revise health curricula so that they're relevant to LGBT youth, so that when we ask them if you ever got HIV education next time, they'll actually remember it. It's used to help schools establish safe spaces where young people, if they're afraid of bullying or something, they know they can go to and have an adult there who will support them. It's used to support gay-straight alliances, which are student-led clubs that promote tolerance and acceptance of diversity. And it's used to help schools link students to community organizations that can meet the health and mental health services and know how to meet those needs for LGBT youth. Finally, we're implementing a pilot project of which we're very proud and excited that really hasn't been done. There really are no proven evidence-based interventions to reduce HIV risk among young men who have sex with men. And we're trying to move that agenda along. So we're piloting this in 3 cities, New York, Philadelphia, and San Francisco, and it's meant to be multi-component intervention. So we're promoting HIV/STD testing. We're doing a social marketing campaign to get the word out about this. We're adapting and implementing for the first time an evidence-based educational intervention specifically targeted to meet the needs of these young people, and we're fostering safe and supportive environments in the school and community setting for these young people. We're trying the best we can. What we do know is we simply have to do something about this. It's not going in the right direction. We were appalled by the data and where things are going. And we're working with some terrific people who are beleaguered by budget cuts at the state and city level, and they're trying their best to meet the needs of young people despite all the challenges. If you'd like more information, this is our website, cdc.gov/healthyyouth. Thank you very much.